All right, and welcome to mini number 7, wrist positioning. Let me move that camera so you can see. Oh, all right. So a wrist is real easy. It has three main positions, which is a PA, oblique, and a lateral. And some places require you to do a fourth position. At medical center hospital, they require you to do an ulnar deviation. However, I saw in the book where it said to please don't do that if your patient has, injury. So we'll just show you the routine views for a wrist. So a wrist needs to be as close to the IR as possible. And in order to do that, what you do is you can see that there's a gap there, right, between my wrist and the board. But if I close my fingers and have them move, it closes that gap, all right, up and down. We don't want to do this, but having a closed fist really helps. So for a wrist, we're going to do, I'm just going to show you this way. The collimation has to include part of the hand and part of the distal radius. So about this much on a wrist. The central ray is going to be perpendicular to the mid-carpal area. There's no one particular place that we focus to, just the middle of the wrist. And that should get everything. And, oh, no, okay. So that's the PA. And then we do a PA oblique, which is just tilting it up just a little bit. So I'll let you see the camera do that. And this is about the angulation, okay? There's down, there's up. That's the oblique. So if it makes your patient feel better, sometimes we can put their fingers out like this and be like, hey, and that actually puts them in line with the oblique that we need. Now, too far up and you're looking at a lateral. We just want it to be crosswise. And again, we shoot into the mid-carpal area, make sure it's collimated, and you can see part of the fingers. No, I'm sorry, the metacarpals, which is the palm bones, and the distal radius and ulna. And then we have a lateral. So this is an easy one. I just tell people, give me a karate chop. Boop. Give me a karate chop. And we want to make sure that our elbow is down on the table, because otherwise that's going to foreshorten everything. Put the elbow down. We're going to center again the central ray here, and it's going to shoot all the way through. Make sure you collimate, including the distal radius and the metacarpals. And that is the three main positions for a wrist: a PA, an oblique, and a lateral. Now, if you're in some place that requires an ulnar deviation, I'll go ahead and show you that too. So here's your hand. The two bones of the forearm is the radius, which is the thumb side, and the ulna, which is the pinky side. Okay, so put your hand down. If you think of an ulnar deviation, it's going to go towards the bone it just talked about. So we're going to go this way towards the ulna. All right, a radial deviation is going to go towards the radius. Now, this, I'm not going to lie, is going to suck. It's a hard position to do for patients that have a wrist injury. So the best way that I tell people is I put my hand on their wrist and I say, look, I'm super sorry this is going to happen, but I want you to take your fingers and point them as far as you can towards the wall or, the door, whatever, and make sure that they do not move their wrists, because you've already collimated. Your central ray is right here. You don't want to move that. You just want them to move their fingers out. All right. So I'll hold their wrist for them and say, just move your fingers out as far as you can. Perfect. Same thing. Shoot it to the mid-carpal area, include the distal radius and ulna and the metacarpals. And that is an ulnar deviation. And going back the other way is it's actually very hard for anybody to do a radial deviation. It just radiates towards the radius. All right. Um, I'm not going to get into the special ones that they have. They have a Steacher, a modified Steacher, which just simply means doing modifications to the wrist at different angulations where you can do put it on a board at 20, you can hammer it down and angle 20. They are for the scaphoid bone, which is right here, to look for any fractures in the scaphoid. Um, there is also the Gaynor Heart method, which you actually, oh, it hurts, shoot in through here so that you can see the carpal tunnel. And then there's another one where you do this and you can shoot the carpal bridge. But I just want you to know the main routine projections for right now. We will get into the special projections later. Okay? All right.